Joining us now is Eric Lipton, investigative reporter at The Times, lead author of this report. Mr. Lipton, thank you for making time to join us tonight. I appreciate it.
Thanks for having me.
I feel like we are living through the consequences of the slow and random and unfocused response from the federal government. It does not surprise me to read detail about how slow it was. I was very surprised in your reporting, though, to learn that there were so many people inside the administration that seemed to know that's what was going wrong and how big a deal it was. But for whatever reason, they just couldn't get through to the president that it was a problem. Is that a fair takeaway from what you and your colleagues discovered?
I think that there was a group of physicians who work for the federal government whose job is to prepare for pandemics, who were comparing notes starting in January as they were trying to figure out just what needed to be done. And they became increasingly concerned over the need to shift from attempting to contain the virus to moving to mitigate the effects of it. And they felt as if the switch should be flipped to mitigation by the middle of February. And what the date in which you flip that switch, you have just a week or two, and the consequences are enormous. The number of people who will get sick or die if you don't flip that switch within that 1 or 2 week period, it's enormous. It's a difference between what's happening in California and what's happening in New York. And they were growing increasingly concerned, particularly as the middle of February came, and they saw all the signs that it was time to flip the switch, to go to mitigation full steam ahead.
And the reason that they didn't remains a little fuzzy. I mean, you and your colleagues report that they did. This group of very influential, very important advisors comes to that conclusion that it's time to flip that switch, as you say. They make a plan to present this to the president, to talk to him about mitigation, to talk to him about all the stuff that we all learned would ultimately need to be done. But it seems to get derailed. The president gets upset that a CDC official makes a public warning before he was willing to say anything that stark. There seems to be some confusion in terms of when the president is actually supposed to talk to these advisors.
Right. Well, the president was in India on a very short trip at the time that his top medical advisors had reached the consensus that it was time to go now for this flipping of the switch. And so they decided, they would wait until he got home because they wanted to present this to him in person. And in the interim, a CDC official spoke at a press conference and said, we're going to need to, consider closing schools and interrupting society. And as soon as she said that, the stock market began to tank. President Trump was getting on a plane at that moment on his way to come back to the United States, and he was furious because this was the beginning of the major decline in the stock market. And by the time he got home, he was railing out the head of the Health and Human Services, angry at what had happened. And the net result was that there was a 3-week delay before the president stood there and said it's time for it's the 15 days to stop the spread, that whole campaign. And that 2 weeks of delay is really consequential in terms of the number of people that in places like New York. And it's the governors who have the power to make those calls, but they need the leadership from the federal government, from the president, who gives them the cover to say, we need to make this move. Our health experts have concluded that now this is the time to go. And instead, what happened was different governors made different choices, and those choices had enormous consequences.